Well, good morning, everyone. My name is Dr. Catherine Hamrock. I'm the Chief Medical Officer here at Metro Community Health Center, and I'd like to welcome everyone this morning. Metro Community Health Center was founded in 1999 specifically to address disparities and inequities in healthcare delivery in the east end of Pittsburgh, particularly in Wilkinsburg and surrounding neighborhoods. We've had a special mission to address these healthcare disparities in communities of color, in the LGBTQIA community, and amongst people who are financially disadvantaged. And we treat everyone here with full service medical, family medicine care, dental care, and mental health care, regardless of people's ability to pay. Now, despite that, and despite making it clear to folks that we will see you whatever you're willing to pay or are able to pay, lack of insurance has always been a barrier to care. I can't tell you how many times in my career, or during the course of a day in the office even, I talk to a patient and they say, no, I didn't know this was available to me. Or worse, we have people coming in with more catastrophic illnesses, and they hadn't seen us because they were worried that if we did find something, we wouldn't be able to take care of the consequences of that. And because of people's inability to get insured, that in and of itself is a barrier to getting good preventive health care services, cancer screening, and management of chronic illnesses before they become a real problem. So what I'm trying to say is we could have the best healthcare system in the world as far as quality of care, but if people can't access that care, it does us no good. Thankfully, we're here in Pennsylvania, and we have our own medical insurance marketplace that we're going to talk about today, where people can sign up for and receive medical insurance and break down that barrier to care. I can tell you that in our experience with our patients, they had no idea when our community health navigators work with them what they qualified for, how much money they'd save by going through Penny, and the sense of relief they feel when they can insure themselves and their families. So you didn't come here today to hear me talk. You came here to hear our next guest, Governor Tom Wolf. It's my distinct honor and privilege to introduce Governor Wolf.
I'm not sure they want to hear me. Hey, come here a minute. Is that a misspelling?
No, that's the right spelling.
That's the right spelling.
Yeah, that's the right spelling.
All right, okay. So thank you. I'm not sure anybody's here to hear me, but I am really pleased to be here. But I want to thank you and Dr. Freeman for what you do, your dedication. We were talking earlier about the amount of time that you have spent dedicating your lives to making this community better. And I think, Dr. Hammock, you're right, that it's one thing to be able to provide the health care and have the expertise here, but the access is really important. And that's why what we're talking about today is so important. Penny is Pennsylvania's health insurance exchange. It's the place to go for that access. If you're concerned about whether you can take advantage of the great skills in a place like this, or anywhere in Pennsylvania, Penny is the place to go. It's the one-stop shop for Pennsylvanians to purchase health insurance for themselves, and it's a really big deal. My administration, and I say that, my administration, actually Jessica, created Penny last year to provide affordable, accessible health care coverage for residents in our state. And Penny has already helped more than, used to be 340,000, it's now 360,000 Pennsylvanians to access state health insurance. And that has made our state healthier. The issue right now is that open enrollment for Penny is going on right now. It ends January 15th. Today is the 5th. So we have 10 more days to enroll in Penny. So that deadline is fast approaching. We need to sign up by January 15th. And it's the last day that you can get coverage. This is the way insurance companies work. You have open enrollment. We've had it since when? November 1st to January 15th. So if you are somewhere in Pennsylvania and you have not taken advantage of this, go to penny.com and check out what we have available and what you could actually get in terms of health insurance. You have probably more options than you think, and health insurance is probably through Penny cheaper than you think. Again, part of Penny's mission is to make health insurance more accessible. But we also have a fantastic customer service team. And Zach, where's Zach? Zach, you and your team take care of making sure that when people call in, you're not getting hung up for a long period of time. You're actually going to be talking to somebody, and they can help you get to the right insurance coverage for you. They can also help you get the kind of pricing that you're looking for. 90% of the people who have signed up for Penny have actually qualified for savings. And I think it helps to actually go through the team to talk about what you might be qualified for. Again, that customer service team is going to help you get the best possible insurance product for you, but it's also going to help you get it at the best, most affordable price. When everybody has access to health insurance, that's a good thing for everybody in Pennsylvania. That helps all of us. And so we need to make sure that we continue to do everything we can to get people to get insurance, to have access. Pennsylvania right now, the last 7 years, we have gone to the lowest uninsured rate of Pennsylvanians in Pennsylvania history. We're down around, what, 5%? 5% of Pennsylvanians are uninsured. When I took office, it was over 10, I think. We were way up there. So we have really moved the needle in this regard, and Penny is continuing this. The first big thing was the expansion of Medicaid, and that insured initially 720,000 new Pennsylvanians got them health insurance. Penny is another 360,000. With what's happened during the pandemic, it's now well over 1 million people, new people who have signed up and gotten health insurance. So Pennsylvania has made some great progress. We're now moving into the second year for Penny, and through this important resource, 22,640 Pennsylvanians have accessed health insurance for the very first time. For Pennsylvanians and re-enrolling in Penny, that's just this year, the new group. For Pennsylvania's re-enrolling in Penny for coverage in 2022, we've already seen approximately 50,000 people have increased their coverage from last year. And again, that's because they qualify for financial assistance that they didn't know they had last year. So if you don't have health insurance, or if you're out there and you're struggling with costs, go to penny.com today. Get health insurance coverage that works for you and your family. And now I'm going to turn this over to the real architect of Penny in Pennsylvania, and that's the Pennsylvania Insurance Commissioner, Jessica Altman.
Good morning, everyone. My name is Jessica Altman, and I have the privilege, as Governor Wolf said, of serving as Insurance Commissioner for the Commonwealth of Pennsylvania. I want to start by thanking Metro Community Health Center, Drs. Kathy Homrock, hopefully I said that correctly and you're over there, and Dr. Freeman for hosting us today, but really for their commitment to the care, to the equity, and to the well-being of people in this community and in Pennsylvania each and every day. I also want to thank, of course, and acknowledge Governor Wolf, Senator Jake Costa, Representative Tony DeLuca out here in the audience, and Representative Dan Frankel, as well as Zach Sherman, Executive Director of Penny, for their collective dedication to working together to ensure all Pennsylvanians are aware of their coverage options. In 2019, Governor Wolf signed into law Act 42, a historic reform to health insurance in the Commonwealth that would create an online exchange operated by the state in lieu of the federal government. The legislation provided for lower premiums and increased access to health insurance by developing a state-based health insurance exchange and a new reinsurance program. That legislation was a step towards making health insurance more affordable for all Pennsylvanians and more accessible to all Pennsylvanians. The reinsurance program created by Act 42 is providing measurable savings. This year, the program is resulting in 2022 individual market premiums that are 5.5% lower than they would be without the program. And as you now know, the state-based exchange created by Act 42 has a name, Penny. Penny opened for business at the start of open enrollment in 2020 and provides individuals and families with the ability to shop for and compare high-quality healthcare plans and easily apply for financial assistance. And unlike the federal marketplace, Penny is run by Pennsylvanians for Pennsylvanians and is truly here to help you connect to coverage. And over 360,000 Pennsylvanians have taken advantage of that. The insurance department and Penny strongly recommend that Pennsylvanians shop around for the best plan to fit their individual, family, and financial needs, even if they are currently enrolled in a health insurance plan through Penny. Penny.com is the place to do that. And with that, it is my privilege to introduce Zach Sherman, Executive Director of Penny. Thank you.
Thank you, Commissioner. Good morning, everyone. I'm Zach Sherman, Executive Director of Penny. A sincere thank you to Drs. Hamrang and Freeman, Commissioner Altman, Senator Costa, Representative DeLuca, Representative Frankel, and Governor Wolf for helping us alert Pennsylvanians that the deadline to enroll in quality health coverage is rapidly approaching. As a reminder, open enrollment runs through Penny.com until Saturday, January 15th. This is the last chance for Pennsylvanians to enroll in health insurance for 2020. Let me also remind you that Penny is not an insurance company. Penny is an unbiased insurance marketplace that connects Pennsylvanians to financial assistance and health coverage. The plans sold through Penny are available in the individual market on and off the exchange, but only Penny is the link to the subsidies available to offset the cost of monthly premiums and out-of-pocket expenses. I cannot stress enough how the American Rescue Plan changed the affordability of health coverage. I've been working in and around the Affordable Care Act since the beginning, and these savings are, in a word, extremely significant, or two words. More than 90% of the 360,000 Pennsylvanians signed up today are receiving financial savings, which on average is more than $450 a month. If you checked out marketplace coverage in the past and were turned off by the cost, I urge you to go to Penny.com now and get a new quote to see how things have really changed. Penny is for all Pennsylvanians. We're continually improving to serve more individuals and families in the interest of making the enrollment process as straightforward and simple as possible. Through Penny.com, we have easy to navigate tools to help people filter and sort plans based on preferences such as monthly and annual costs, doctors and providers, and prescription drugs. New this year, we've made the online application available in Spanish. We've made the online application as well as customer notifications fully available in Spanish. We also know that health insurance is not the easiest thing to navigate, and that's why in addition to the online tools, we have an entire team of certified pros ready to help in your preferred language at no cost to the customer. Help is even available right in your neighborhood, like here at Metro Community Health Center and countless other organizations across the state. Help can either be in person or virtual. I urge anyone considering signing up to not wait until the deadline, to not wait until January 15th. The sooner you get covered, the sooner you can have the peace of mind that comes with knowing you will be able to access health care services when you need them. So don't wait, start the process today. You can go to Penny.com, that's PENNIE.com, until January 15th to get covered. Penny customer service will even be available until midnight on the deadline day on January 15th. That's Penny.com or by phone at 1-844-844-8040. Thanks so much for being here today, and I will now introduce Dr. David Freeman. Oh, there you are.
Thank you. Hi, I'm Dr. David Freeman, one of the family practitioners here at Metro Community Health Center. I too would like to thank Governor Wolf and all of our members of government who are here supporting this initiative so that we can operate better as a community family practice. You know, we are very proud and privileged of what we've built here at Metro. over the years to be able to provide for the underserved, to provide for our local communities, and even provide for people who come from quite a distance sometimes to seek our care. But some of them do kind of fall in that crack of not being insured, or sometimes not being insured well enough because they don't have access to health insurance that some people, I think, honestly take for granted. And we can actually be able to provide care for them on a local level and even give them services that they can access here at Metro. But sometimes we can't do other things for them that we want to be able to do. It's pretty much on a weekly basis. Even yesterday, I had a patient that I talked to who, the conversation starts something like, well, I see you don't have any health insurance coverage at this time. No, and it's not a judgment. It's a fact that I want to be able to help them with that and to be able to navigate our system a little bit, because I know what I can provide for them, but oftentimes I need to get them to see specialists. I need them to get other testing done. And frankly, it's just not so easy to be able to accomplish that if they don't have some form of health coverage. So then the conversation moves into, well, do you expect to have any kind of health coverage from any source coming up? What might that be and what might that look like? Because there are things that we need to accomplish. And a lot of times we have to kind of have conversations about where those sources might come from. Being able to access Penny is a great help to us to better assist our patients in getting the care that they need and moving forward, the care that everybody needs and deserves, frankly. So we do appreciate what the state has done for us with this service and being able to provide for our patients and give them better care going forward. We would like to work more with the government to be able to provide the care that our patients deserve. Thank you very much. And I'd like to present Senator Costa.
Thank you.
Thank you.
Well, thank you very much, Dr. Freeman and Governor Wolf and everyone involved with Metro Community Health Center. Thank you for what you do in our community. As mentioned, representing and providing comprehensive quality care to the men and women and children in our community here in Wilkinsburg and in the eastern part of the eastern suburbs here, and particularly, it's important work, and we want to say thank you, particularly during these many, many months of this pandemic we've been dealing with. So my hat's off to all of you for the work that you do, and just thank you very much. I'm here also to sound the alarm that we're running out of time to have folks sign up for Penny, as was mentioned by Zach, in terms of the deadline being January 15th. Representative Frankel and I, over the years, have put together this time of year, we would do a community forum where we would do sign-ups and have people come to us and sign up, and insurance folks there would come and help us, and as well as some of the other providers. Can't do that as we like to do, as we've done in the past. So our goal with today is to sound the alarm that we're running out of time and encourage folks to sign up for Penny and recognize certainly the need for the healthcare services that we'll need, and but more importantly, also looking at the savings that are attributed. $450, I think you said on average, Zach, pretty significant. Multiply that by 360,000 folks. That's telling us something. But I'd be remiss if I didn't talk a little bit about what something Governor Wolf talked about, and others mentioned, the Affordable Care Act. I would tell you, prior to Governor Wolf coming here in 2013 and 14, we struggled and we fought. Representative DeLuca, Representative Frankel, and I were all in the General Assembly, encouraging, pleading our Commonwealth to join the Medicaid expansion program, and we didn't do that. But the very first thing that Governor Wolf did when he came here was to put into place and getting Pennsylvania part of that program. It's resulted in, and it's significant, I have to thank you for recognizing that, because it's several 100,000 people who attained insurance at that time, and a level of care which I think is appropriate. You follow that up by doing things in the CHIP program. And then finally, last couple of years, working with Commissioner Altman, put together the Penny program, which is providing the insurance that we talked about, the marketplace, saving almost 5% for folks. In my view, that's significant. And I think that, so when you put it together, it's over 1 million folks whose lives, who their families have been impacted by decisions along those lines that government has made, working in conjunction with his executive, chief executive, our governor. So my hat's off to Governor Wolf and his insurance folks and his team for the work that they've done. But today's about spreading the message, telling folks that we need to get folks engaged and get them signed up work together with the insurance department, with the navigators that are available to them to be able to get folks the coverage that they need. It will change lives, and it has changed lives. Just as the folks who come on off that elevator 6 or 7 times since I've been here, their lives are being impacted in a positive way because they have access to community health care that's quality health care. We need more of that in Pennsylvania. So thank you very much, Governor. It's my pleasure to introduce my good friend, Representative Tony DeLuca, our insurance chairman for a number of years. Tony.
First of all, I want to introduce myself. I'm State Representative Tony DeLuca from the 32nd Legislative District. I want to thank the center here for hosting this, and really it's the first time I've been here, and I'm very impressed with just a little bit I've seen. But I will make myself more knowledgeable about this facility. But I want to thank Governor Wolf. We heard about how important it is to get this signed up by the 15th. But I'd like to give you a little information background of how Governor Wolf and his team, along with myself and Senator Acosta and Dan Frankel, chairman of the Health and Human Service Committee, helped to shepherd this Act 42. And it wasn't easy, and we had to work together to get this done. As Senator Acosta mentioned the Affordable Care Act, that act, as you know, was trying to be repealed so many times. And I had, as the chairman of the Insurance Committee for the Democratic side, had, just in case they would have overridden it, I had a resolution and a bill in there to make sure that we covered the essential benefits, which never seen the day of light from the majority party. But evidently, when Governor Wolf came up with this program, and it just shows you what we can do if we're working together. And by working together, we got all the stakeholders of this together. I worked with my counterpart. Senator Acosta worked with his counterpart over there, and so did Representative Frankel. And we worked together because we've seen the value of insuring more people. And as we know now, we see so many people out there who are taking advantage. I get calls all the time in my office, I'm sure my colleagues do too, how important this penny program is. There are people today that don't have to pay anything depending on their income in that there. And like it was said, it has only gone up 5% so far. It's terrific. But I want to commend the governor and his staff and the insurance commissioner out there for bringing up this proposal. And I have been very honored, I'm sure with my colleagues there, Senator Acosta and Representative Frankel, to be a part of it. Because it's not easy to get anything passed up there in Harrisburg at this time. And there's a lot of good legislation that just sits there that benefits people's lives. And we just haven't taken advantage of it. And I hate to talk a little bit more, but I think it needs to be said while we're talking about this. The fact is, the partisanship has to stop on both ends to benefit the people and our Commonwealth, because they're the ones who are suffering and who we're representing. And somewhere along the line, I've been up there quite a while, and somewhere along the line, we forgot what public service is all about. It's about representing people. And maybe we'll get back to that, hopefully, with the public out there, and when the public realize how important this legislation is and some of the other legislation that Governor Wolf has espoused, but unfortunately, because of the DNR, we just don't move it. So again, and I certainly want to thank our emergency services and the nurses and nurses' aides for all the fantastic job they're doing out there. It's a tough job today, and you've been doing y'all been doing a good job on behalf of the people of Pennsylvania. And people just don't recognize it because it's like good health. You take good health for granted until you lose it. Then you say, why didn't I do it? Again, I want to thank Governor Wolf and the staff here, and thank you for having me the opportunity to be here to say a few words. Thanks a lot. Oh, okay. Next, I didn't realize that we had a problem. My good friend Dan Frankel here, we go back and work together, and before he was the chairman, he was on my committee and was a good committee member. He cares about people like a lot of us in the western part of this state here, and Dan Frankel.
Thank you, Tony. I want to thank Metro Health. All of you doing tremendous work in this community for many of our most vulnerable people, and we're very grateful. And I'm really privileged to be up here with this group of people who have put together the consensus that we had in Harrisburg to be able to do it. And the governor's leadership was extraordinary in order to get that done. As Tony talked about, trying to do some of these things is challenging. But I think one of the messages that should go out in these last 10 days is we're urging people to sign up, and to take comfort. In an era where there is extraordinary partisanship on issues of public health and health care, which are beyond my imagination, the fact of the matter is there was a bipartisan agreement that got this done with the governor's leadership to forge it. So I think people should understand that this is something that is embraced by all of us, and that's why it's important, and that's why people should feel comfortable signing up for this. In an era where, public health has become partisan and health care, we were able to come to agreement here under the governor's leadership to put together this program, which is benefiting so many Pennsylvanians and has the opportunity in these coming few days to do so much more for so many others who really need this. So this is an important moment to be able to try and communicate that urgency to people, and I'm so privileged to be up here with this team of people at the legislative level, team of people in the provider level who are doing, I think, the work that is going to actually make a difference in Pennsylvanians' lives. I also want to take the opportunity here to introduce a colleague of mine in the House who's just been here as in her first term and done a great work in her community, and that's Representative Emily Kincaid. With that, let me bring back up the governor, and thank you, Governor.
Thank you. And again, let me thank you, Senator Costa. Thank you, Representative DeLuca, Representative Frankel, and Emily, thank you, Representative. Thank you for being here. Would you like to say anything?
No, I'm
okay.
I think you guys have done a very good job of talking about that.
Again, the point, the message here from the Insurance Department, Commissioner Altman and Zach, is the marketplace is open. Open enrollment extends through midnight on Saturday, January 15th. So please, if you don't have insurance, this is your opportunity to sign up. Okay, with that, I'll take questions.
Do you see the decline in the life expectancy, the lack of insurance as being a contributing factor in the recent decline in the life expectancy of Americans, and particularly those, disadvantaged, or, especially in the Black and brown community?
I have an opinion on that. One of the ironies of American healthcare is I think we probably have the best healthcare system in the world in terms of the skills and talents, and yet we pay, 7% above the OECD average. Our healthcare costs are that high, and the outcomes, morbidity, mortality rates, infant mortality rates, maternal mortality rates are higher than in many other countries with much lower costs. So I'm not sure if life expectancy is one of those things, but maybe, Jessica, you want to opine on that?
Yeah, it's a really good question, and there's no perfect yes or no answer to that question. But one thing I would point out is that healthcare is not about a single point in time or a single year in your life. Healthcare is about your whole life, how you live your life, your well-being, the healthcare you're able to receive and afford over your life. And while we are blessed to have the Affordable Care Act now for over 10 years, Medicaid expansion now for over 6 years, if I'm doing my math right, and all of these changes now with Penny that are letting people get covered and letting that coverage give them access to the health care that they need. We have places like like this center that's providing care regardless of whether you have coverage or not. We need to make sure people have that today, in 5 years, in 10 years, in 20 years. And we know they didn't have it 20 years ago because we didn't have the healthcare system to support it. So hopefully we're building this infrastructure, and we're going to keep this infrastructure that allows health to thrive over the lifetime of Pennsylvanians. So that's my best answer. Thank you.
Good job. Any other questions?
Governor,
Yeah.
on a separate, different subject, your reaction to the fire this morning in Philadelphia where the 13 people were killed in the Housing Authority fire?
Yeah, I don't know enough about that, but this a tragic thing whenever something like that happens. I'm really sorry.
Governor, it's a little early, but is it ever too early to talk about transportation? We're looking at the funding cliff of Act 89, where $400 million will have to come out of the general fund versus the turnpike. I know that you put together the Long-Range Revenue Options Committee. Do you think that we will find a solution that can sustainably come out of the general fund, or will we kind of short gap with ARPA and then see what happens?
It's interesting. There's actually a bunch of transportation gurus are coming, including I think Senator Costa. Here's the issue that we have, and it is a difficult one, but the source of funding for highways and bridges in the past has been the fossil fuel tax. And as cars and trucks become more fuel efficient, and some cars and trucks are increasingly not even internal combustion engines, electric cars, for example, don't even pay that tax. The sources of funding for highways and bridges, both at the federal level and at every state level, has gone down. So it's something that we're all struggling with. Act 89 happened before I came into office, but it was a part of an effort, I think, to try to figure out some way to extend the life of the fossil fuels tax as a source of funding. But we're quickly coming to the end of that, and I think we have a lot of work to do to come to agreement on how we replace that funding. I know, Senator, you want to add anything to that?
No, I think you're right, Governor. I think we have to take steps to address the shortfall there. Also, possibly the transfer from the motor license fund to support our state police. Those are all things that are important in this conversation. But one of my major concerns is the impact on transit. While we know we're getting significant dollars from the federal government for infrastructure, my concern has always been access to adequate transit for our region and our community, which we did address in Act 89 to some degree. But I think it needs to be a comprehensive approach, and I think that's what we're trying to address here. The Governor's Commission came back with reasonable recommendations that we need to explore. But we received our last $400-some million from the Turnpike, so it's certainly on the front burner. We have to have this conversation, and but it needs to be a comprehensive approach. It needs to be roads, it needs to be bridges, it needs to be transit, it needs to be airports or waterways, et cetera. It needs to be a comprehensive approach, and reliance upon fossil fuel taxes, I think, in my view, I think, it's going to be difficult to continue to be able to do that. So we need to be more creative and thoughtful in our approach of how we work to address the funding sources that we do need. So I think it's something that's going to be a priority for us over the course of the next 6 months in Harrisburg, and look forward to being part of that conversation.
Governor, if I could ask a real big response question.
Yeah.
Federal response teams are deploying. The National Guard is already doing some work in nursing homes. Are you considering another emergency declaration or some other action to assist with the response, or is there action you'd like to see the state legislature take to help support the response?
I think what you're talking about is the federal strike teams. We've been working. The concern right now is with the hospitals, make sure that the healthcare system doesn't get overwhelmed with the new cases. And as part of that, we asked the federal government to send strike teams. Now they make their own, FEMA makes their own decisions. They've decided to send 2. We asked for more. They sent 2, and they decided that one of them would go to Scranton, one of them would go to the York area. That was their decision. We already have National Guard, Pennsylvania National Guard, working in long-term care facilities. And so the Department of Health, the legislature, we're all working together to try to figure out what more we can do to help the healthcare system cope with this increase in demand.
Is there anything in particular that you're watching that would necessitate further steps or that would trigger further steps?
We're watching it every day. hospitalization rate is especially important, and what actually is happening after 2 years of this pandemic. There's a lot of burnout in the healthcare. I don't have to tell you that, and people have worked hard and are just looking for help. So I think everybody in the state wants to make sure that we're doing at the state government level everything we can to help.
Governor, tomorrow's January 6th, obviously, and the insurrection. And Pennsylvania had a lot of people arrested, and especially I believe Bucks County. I heard a report, I think, on NPR. Any concerns, any thoughts about tomorrow and just in general, the whole deal, the whole issue?
Tony really unleashed a whole thing, sort of broad philosophical conversations about our democracy. I think what we saw on January 6th, and this is me speaking, is the vulnerability that we have as a democracy. And that what Benjamin Franklin said coming out of the Constitutional Convention back in 1787 was, this is a republic, if you can keep it. And I think what we learned in last January 6th is that this is an eternal challenge that we all face. This is a perpetual experiment, this democracy, and we can never rest. Anything else? Yes?
I'm sorry, Governor. This is actually a question for Representative DeLuca, if that's all right.
Representative
Sure.
DeLuca. That's okay with me.
I was hoping you wouldn't mind. Representative, there's been a lot of complaining, concern that Oakmont was added to your district with the new map. And I'm curious, two things. One, have you decided on re-election? Sorry. Two, do you think it's a good map? Are you concerned that Lakemont will get lost, that Penn Hills and Oakmont will just sort of dominate?
First of all, let me say that I will be running, number one. Number two, I don't think Oakmont will be lost any different than the communities I'm losing, like Fox, part of Shaler and Asper on the other side of the river, which I hate to lose. But unfortunately, I will be representing all the communities like I have done over the years. So I think I look forward to working in Oakmont with the citizens over there. As you know, it's adjacent to my district anyhow. I live in Penn Hills. I'm about 4 miles away from Oakmont, and I know a good bit about residents of Oakmont, and I hope to give them the same services that I have over the years provided to the 32nd Legislative District. And I'm looking forward to working with the individuals. I think it's an opportunity for me to get out there and work like I have been working all over the years and represent. First of all, let me say this to you. Even though I'm a Democrat, when I get elected, I drop the label. I work for all the people. And I think that's what we need in public service. And I don't ask them if they're a Republican or Democrat. I get more people coming in my office, and I don't even know where they're from because of the service we do. We have one of the highest profile offices around. And I'm looking forward to establish that report with Oakmont. And we already do get some of the individuals from Oakmont that comes in the office. So I look forward to it, and I will be running. And hopefully I'll be out there and selling myself to the people in Oakmont, telling them what I have done, what I intend to do. And I'm not a representative who just sits back and doesn't do anything. So we're, matter of fact, last year I led the legislature in the bills introduced that are good bills that affect people's lives that they are not letting out. And I will be addressing that in a couple of weeks at a press conference in Harrisburg. Thank you. Is there any other question you want to ask me?
Sorry, more generally, I don't know if this part got lost. Do you
Pardon
think
me?
I apologize. I don't know if this got lost in my sort of cascade of questions. Do you think it's a good map, the redrawing?
Do I think it's a good map?
Not just for you, but in general.
Well, I haven't looked at all the districts, so I can't comment on all the districts. I think it's more continuously the way it should be because I flow into everything. The other map, even though I hate to lose it on it, going all the other side of the river there, I think that's what they're trying to correct. As they, adjacent to all my districts, so it meets the guidelines that they have set, that the governor and his team have set. And but I haven't looked at all the districts, and but you know, I think it was a fair map for my district, and so I can't say anything about the other districts.
The senator has a comment.
Yeah, Senator, go ahead, Senator.
I'm sorry. Thank you very much. I serve on the Reapportionment Commission that approved the maps, and I supported the maps at this point in time. It's important for folks to remember that this is a preliminary plan. We were sort of on their timeline to get things moving because we have limitations with respect to the primary election day, for example, and the petition day. So at this point, we would begin our 30-day process on the 16th of December. We have hearings tomorrow and Friday in Harrisburg, taking input, as well as next Friday and next Saturday, as well as over 600 or 700 comments from different people across the state who are commenting on the maps that they've been drawn thus far. So this is a process, and I think it's important for folks to know these are not final maps. I will tell you the maps will not look like what they look like today, will not look like this when we do our final plan, probably on possibly February or January 28th, it looks like. So if folks have concerns, they should address them through the Reapportionment Commission, our website, and provide those comments, or be able to try to participate with live public comments during one of those hearing days. Thanks.
So thank you, everybody, and remember the open enrollment day ends Saturday, January 15th at midnight for Penny. So thank you very much, and Dr. Freeman, thank you very much for having us here, and again, Representative Kincaid, thank you for being here, as well as Senator Costa, Representative DeLuca, Representative Frankel. Thank you, and thank you everybody for being here. See ya.